Our presentation is on SB 224, People Instruction Mental Health Education by Group 9.
75% of mental health illness begins between the ages of 10 and 25. The problem is that California is failing youths in providing mental health care. As of 2021, California is ranked 33rd in the nation on children's mental health care. This is because there is a shortage of mental health professionals for California's youth. California's percent of need for mental health professionals in 2021 was 23.4%. As of 2021, California is ranked 19th in the nation on youth with at least one major depressive episode. That is about 415,000 youths affected. As of 2021, countrywide, over 2.3 million youth have severe major depression. In 2019, 1 in 4 youth ages 18 to 24 had suicidal thoughts in the past 30 days. The COVID-19 pandemic exacerbated youth mental health needs. This is exemplified by mental health-related emergency visits increasing during this time. There was a 24% increase among 5 to 11-year-olds and a 31% increase among 12 to 17-year-olds. In 2019, suicide was the second leading cause of death among adolescents ages 12 to 17. High school students struggling with depression are 2 times more likely to drop out. Students are also more likely to turn to substance and alcohol abuse to cope with mental disorders. This increases impulsive suicidal behavior in depressed youth.
Policy solution. So the California SB 224, People Instruction Mental Health Education, ensures that all Californian middle and high school students receive age-appropriate mental health education from a qualified instructor at least one time during middle school and one time during high school. It raises awareness on mental health challenges, reduces stigma associated with mental illness, and educates and empowers students to seek necessary help. It is a state-level policy and a standalone policy. In January 14, 2021, Senator Anthony J. Portantino introduced SB 224. SB 224 passed Senate June 1, 2021, and passed Assembly on September 2, 2021. In effect, it was approved by the California Governor Gavin Newsom and chaptered on October 8, 2021.
Policy landscape. California SB 224 is modeled off the California Healthy Youth Act, AB 329, which requires school districts to provide students with comprehensive sexual health and HIV prevention education at least once in middle school and once in high school. California SB 224 is also related to Specialized License Plates Mental Health Awareness, SB 21, which requires the California Department of Education to work in conjunction with the DMV to sponsor a mental health awareness license plate program. The revenue from the license plates will be used for mental health services in public schools. California SB 224 is also related to the Behavioral Health Workforce Rehabilitation Act, SB 964, which requires a stipend program for students pursuing social work within California community colleges and California state universities, and it stabilizes the behavioral health workforce.
The public opinion. Some supporters of SB 224 are the CEO of National Alliance on Mental Illness, Jessica Cruz, and they argue that SB 224 plays a significant role in connecting students and families to the appropriate resources necessary to respond to mental illness. Other supporters also include State Senator Anthony J. Portanino, the California Alliance of Children and Family Services, California Youth Empowerment Network, the California Alliance of Child and Family Services, CEO Christine Stoner Mertz, and Senator Ben Hueso, who argues that SB 224 is necessary for increasing awareness, empowering students to seek support, and reduce the stigma associated with experiencing mental health challenges. Some opposers are the Citizens Commission on Human Rights. They believed in informed consent rights for all mental health treatment, arguing that SB 224 fails to require the education to include training on informed consent.
Our logic model was created to provide a picture of how our research policy is intended to work. So as for the inputs or what resources will be used, marketing resources will be greatly needed, and this includes a location, incentives, and speakers. Besides that, funding is a primary resource that will be needed, and you will hear why in a few moments. So looking at the activities section, the marketing resources will go towards creating a marketing campaign marketed towards parents and school staff who hold the responsibility of teaching the mental health curriculum. And the funding resources will go towards purchasing curriculum materials and training staff on the updated educational guidelines from local educational agencies, as well as creating the state and district level partnerships. And it's essential to create this partnership because it is the California Department of Education's job to incorporate mental health into the state standards, while the districts are the ones responsible for offering the new material. So as for the outputs, what results from the activities, they include the actual completion of the marketing campaign, the workshop curriculum plan, and therefore the implementation of the curriculum, the training/mental health workshop, and then the state and district level partnership. Moving on to the short-term outcomes, there will be an increased knowledge of signs and symptoms of mental health and mental health challenges, an increase in youth mental health education, and intermediate outcomes would include more youth being interested in utilizing mental health resources and utilization of mental health resources services. And the long-term impacts would involve acceptance of mental health intervention, treatment, and guidance at an early age, and a decrease in mental health related emergencies.
Our short-term question is, did policy SB 224 increase knowledge of common signs and symptoms in mental health challenges among middle school and high school students in California? Our intermediate question is, was there an increase in mental health resource outreach among middle and high school students in California? Our long-term question is, did SB 224 decrease mental health related emergency visits among middle and high school students in California? Our evaluation design is a quasi-experimental time series design which is focused on the long-term impact. We couldn't have a comparison group to test effectiveness. Also, there's availability of mental health data which is well recorded among age groups we are interested in. Our specific data and indicators and timeframe are to compare mental health disorders ER visits in middle and high school students in schools before and after the policy, which is 3 years before and after, starting in October of 2021 and ending in October of 2027, to detect interruption in mental illness prevalence. The data collection and time frame would focus on our long-term question, which is, did SB 224 decrease mental health related emergency visits among middle and high school students in California? The data we would be looking at would include data on middle and high school students in California. Our time frame would be from October 2021 to October of 2027 because the bill would be enacted in 2024. The data would be collected every year throughout the 6 years. We would collect data from school districts, and we would also collect data from local hospitals on the California Department of Public Health on reportable mental health related emergency visits of middle and high school students between 2021 and 2027. We would also collect data from the Data and Resource Center for Child and Adolescent Health.
Some evaluation challenges include that the mandated mental health education does not apply to those who are homeschooled, enrolled in private schools or independent study programs, and those who do not receive traditional classroom-based instruction. Second, student follow-up through middle and high school is difficult to keep track of because there is always a possibility of students dropping out from their current school district, and as so, this will skew the school district data. Third, the decrease in mental health-related emergency visits may actually be due to other factors, such as the existence of outside mental health resources and improved mental health awareness through the media. For the economic evaluation, we will look at the direct costs through a societal perspective. So we would look at the cost of time that it takes for instructors to adopt their curriculum to meet the guidelines of the policy, the cost of training the proper instructors/partners in teaching the curriculum, cost of the mental health curriculum materials provided to the health class, which derives its funding from the local educational agencies, and cost of monitoring the mental health related emergency visits in the schools, as well as the cost of conducting the mental health workshops and training. For the economic analysis, we would be doing a cost effectiveness analysis. So first, we would examine the direct programmatic related costs associated with the bill's implementation. After we gathered all the total direct costs, we would compare SB 2024 to other policies that aim to reduce mental health related emergency visits among middle and high school students. And then as for the unit of health outcome for comparison, we would be looking into mental health related emergency visits, such as reduction rates. And some of the data and sources used will be middle and high school students in California, the CDEs who were tasked to develop the mental health instruction plan, the LEE health education course spendings, and the school district's cost to hire instructors, purchases of curriculum materials, and the cost for the workshop curriculum plan, and also the local hospitals on the rates of mental health related emergency visits. To perform the calculation, we would do the cost of the program divided by the number of mental health hospitalizations prevented. And the time frame would be from January 2021 to January 2027, 3 years before and 3 years after the policies.
Impact on health equity. SB 224 can increase and provide essential knowledge on mental health challenges such as the warning signs, symptoms, management of mental health issues, awareness on mental health, how to find assistance and services, and how to promote mental health wellness. SB 224 can increase access to mental health education to all middle and high school students, regardless of their race, ethnicity, or socioeconomic status within California. SB 224 can decrease health disparity based on students' and parents' beliefs, such as denying mental health treatment due to stigma. SB 224 may also decrease arrests among youth with mental health challenges, as they are 2.9 times more likely to be arrested than their counterparts without these challenges.
Our class question is how do you believe SB 224 will influence other states in their regard to mental health education and wellness?